Tune in every Tuesday from 10:05 a.m. on the Mid-Morning Cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
She's the sweetest voice on the mic. The most awesome voice on radio. Awesome ever. She's awesome. She's awesome and she's the baddest bee in here. Awesome and on 94.7 Abuja.
Yeah, you know this.
Once you hear this sound every weekday, you know that the Mid-Morning Cruise crew is up and about. Yes, good morning, Abuja. How are you doing this morning? Hope you're doing okay. And you know, the usual thing we do every Tuesday morning is the health show. Proudly powered by Nizamiye Hospital, and today promises to be another amazing edition of the show because we're looking at something that every mother at least is worried about. All right, our guest for today is Dr. Tahir Lawan Musa. It's so good to have you on the show today, sir.
Good morning, listeners.
Yes, and you look really bright and really happy.
Thank you.
Yes. Okay, so we're going to go right into it today. Just in case you're a mom out there and you're wondering, you've asked so many questions about teething and everything that has to do with it. Today we'll be looking at teething in babies, right? The misconceptions about teething in children, especially in these parts. I mean, the misconceptions abound everywhere, world over. I was having a chat with the doctor just before we came on, and it's amazing the kind of misconceptions that people have about teething. So we're going to go right into it. And trust me, the phone lines will be open up really soon, so you can ask all the questions you have always wondered about teething in babies, right? Good. So we're going to go right into it. So, sir, please explain to us, what is teething?
Okay, teething, or in this case, teething, tooth eruptions.
Okay, tooth eruptions, yeah.
Why I call it eruption is that by the time a baby is born, a baby that is delivered at birth has about 20 teeth already under his gum.
Oh, wow.
So they are already formed there.
Right.
They will just wait until they begin to pop out one after the other.
Ah.
So that process of popping out for us to see is the teething issue that we are talking about.
Okay.
And that is, there are a lot of misconceptions, like he said in the introduction, about teething. It's supposed to be a very normal process.
Please explain the process.
They usually, from the age of, from day one for a term baby to 3 months, usually you don't see anything.
Right.
Despite the fact that the teeth are under the gum.
Right.
By averagely about 6 months, that is when usually the first tooth will erupt.
Okay.
And it doesn't really cause any serious problem apart from a minor irritation of the gum.
Okay.
Of course, with some little itching, and then the baby will now begin to drool and tries to bite on something that will make him or her feel a little better.
Yes.
So under normal circumstances, that is the only thing that happens. A little drooling, there may be a little pussy, and then they want to bite on something to get some relief.
Right.
That is usually the normal thing.
Right.
Then the tooth finally erupts.
Right. Now, all of these other additions to teething, the pooing, the stooling, the temperature, please clear us on them.
If you see pooing, or temperature, or cough, or vomiting, it's not teething.
Oh.
It's just a coincidental event around the teething period.
Wow.
Now, the way it is that babies, especially those that have been breastfed, have inherited immunity from the mother, from delivery, from the womb, and then from the breast milk. But usually by the age of 6 months, the immunity they have inherited has gone down to its nadir. And they have not developed their own immunity.
Right.
And that is when they are active. They can catch anything and get it to the mouth.
Right.
And that is when the irritation of the gum starts for the teeth to erupt. So anything they get around, they will put it inside the mouth. So with a very low immunity, now being active and putting everything in the mouth, they are now exposed to infections from diarrhea, from things that will cause vomiting, and of course even the respiratory tract infections are very common. So if you see those events around teething, they simply coincided with the teething process,
right,
but they are not caused by the teething process itself.
Oh, wow.
One Indian author says, teething causes only teeth. So if you see any other thing apart from teeth, please ask for help.
Right. Okay. So is it important for a baby to see a dentist? And if it is, from what age? Because I've heard a couple of mothers say, no, I mean, there's no need. It's just the teeth is coming. There's nothing wrong with the teeth. Like you already mentioned that they're already under there and then it's just eruption that we, experience. So do you think it's important? Because I know that I faced that question. I'll tell my story about my baby, but I want to hear from you, doctor.
Okay. It's important to know that this teething process, the eruption itself,
right,
is quite variable.
Okay.
Even in a set of twins.
Okay.
And it's accepted between the age, some that have the first tooth early usually occurs around 4 to 5 months.
Yes.
Now, up to 13 to 15 months without a single tooth eruption may not be a problem.
Oh, really?
So some kids will have their first teeth appears between 13 to 15 months. And after that, there is no cause for concern.
Right.
We get worried if baby is beyond that age and there is no single tooth erupting. Then there is need to evaluate what are the possible reasons for this delay. And usually the first point of contact will be a family physician or the pediatrician, and he will evaluate, and if there are no issues, he will now advise you to see a dentist.
Okay.
By and large, by the age of 18 months, if there is no single tooth, that child should see a dentist.
All right.
Wow. All right, doctor, we're still talking about the normal teething process, okay? And I want to mention something, okay? During this period, there's this malaria child, a child will develop malaria. I know of my sister's baby because she was always having malaria during the teething process. And she was like, all right, let's not go to the hospital because these are all the process. I don't know if malaria is also part of the teething process. Really?
Again, people call any source of fever as malaria.
Yes.
And interestingly, majority of children in this part of the world, their first attack of malaria also occurs around 6 months because the immunity they have inherited has gone down. So teething per se has no direct relationship with malaria.
Right.
If you see any child with high fever, temperature above 38 degrees, please look for a reason for it. She should see a doctor, should be able to evaluate and say this is the reason for the fever, but not teething.
All right, doctor, let's also move on to talking about the misconceptions associated with teething.
Yes, part of the misconceptions are the issues that we talked about. Some people believe that any child teething will have diarrhea, will have cough, will have fever. These are truly misconceptions. I have seen children that will only wake up in the morning and you see a teeth propped up with no symptom at all.
I can attest to that.
Yes.
When I tell people, I have personal experience with my baby, that we don't really have all of those very weird,
Yes.
They don't believe me, but
It's
truly, he's actually teething now. You just wake up and you see that two have come out. And maybe when you're cleaning, just a little bruise, you see blood.
Yes.
I really don't even know. I can't even really tell, okay, this is teething period and this is not teething period. Maybe I'm fortunate. I don't know.
It's supposed to be a normal process.
Okay.
Just the way you wake up one day and see that your nails are long.
Yeah, that's how I noticed it in his mouth.
Gently, but you don't know. So,
and then he wants to itch a lot, that period. And you're like, what's happening inside your mouth? And when you just check, you just see something white.
Exactly. They tend to have some itching.
Yeah.
But apart from that mild itching,
right,
usually there is no problem. The second misconception is that people believe that every child must have teething medicine.
Yes.
And does really teething requires medicine? It's not a disease.
So you're saying that for everyone that gives their child teething medicine, that it's not supposed to be so?
Teething is not a disease. If the itching is so intense, unfortunately, most of the anti-itching medications are also not supposed to be used in children below the around that age that teething is supposed to happen.
Oh, wow.
But that's what you see. The little pain that they have, a little dose of paracetamol might relieve it. And if you give them a hard dummy that doesn't contain fluid and that cannot break, they bite on it a little, or a damp gauze, they can bite on it, they feel a little relief. And that may be all they require.
Right.
And sometimes all you need to do is to wash your hand and rub the place with your clean finger.
Right.
And that's all that is required.
Right.
But some people, one of the misconceptions is that they believe that, in fact, you see some people giving babies from 2 months medicine in the name of teething medicine.
Yeah.
Unfortunately, these drugs are not prescribed in the hospital.
Oh, really?
They are usually prescription between mothers and their friends.
Wow.
Oh, wow.
And if you remember, yes, exactly. If you remember, that was how we found ourselves in trouble during my Pekin saga.
I was going to mention my Pekin.
Exactly.
It took a lot of babies' lives.
Yes. Officially documented ones that court agreed at least 84 children died from my Pekin.
Oh, wow.
In the name of treating teething problem. Now, this drug, because it's not prescribed in the hospital, it was in the market, we never even knew about it. Until what happened before, in retrospect, they began to find out that what happens, these children between the age of 6 months and 1 year, they were dying from an unknown illness. It was in retrospect that they now found that, okay, there is a new teething medicine in town, which unfortunately was the cause of this trouble. Now, this is because people believe that it was a disease.
Right.
But it was never a disease. There was no need for that. And 84 lives is not a joke.
Wow. At this point, we'll open up the phone lines and see if you have any questions to ask Dr. Lawan. He's here answering all our teething problems. It's our problem. It's not just...
It's so interesting that even new organizations, when they have problems, in our literature, people say they're having teething problems.
You see?
Unfortunately, it is deep in the society.
You know, we've taken it to be like normal.
Teething has no problem.
Yes. All right. So the number to call 081 78000947. I know you're there listening patiently and you're like, okay, I'm going to ask this doctor, what's he saying? How can he be saying that teething is not a problem when I have like a stash full of drugs in preparation for my baby's arrival for her teeth or for his teeth? No way. So do us well to call the phone line 081 78000947. Dr. Lawan is here from Nizamiye Hospital and he'll be answering all our teething questions. Let me not add the problem. I was saying problem, but now
Doctor, I wanted to ask, okay, you talked about, all right, let's just take this call then. I'm going to ask this question. Hello, good morning. All right, good morning. Tell us your name and where you're calling from.
Okay, we are speaking with Justice here. Okay, I was having a discussion with the doctor over the teething issue. Hello?
Yeah, go ahead. We can hear you.
Okay. You see, I think I have a 1 year, 1 month baby. And what happened there was, during the time the baby was up to 4 months, 5 months, my mother-in-law started giving her Pican, particular name of the drug Pican, that it helped to release the crisis of the teething process. Understand? Then I'm on the line again, even recently when the little boy is growing another teeth in the lower jaw, the boy started stooling consistent. When I asked, I was told that it is teething, it's a normal process. So I have to make personal research to ask, what is the relationship between stooling and other crises associated with teething, with a baby growing teeth? So but from the information I'm getting now, I'm getting the information now that there's no relationship. So the baby is having other symptoms. You just have to use other medication, not attaching it to teaching. I think I wish my wife is hearing this question.
Thank you.
Glad she is there.
Thank you so much for calling the show today. That's why we're here. Thank you so much. Yes, keep listening, okay? Right. Okay.
All right, doctor, I wanted to ask, okay, since you talked about no drugs being prescribed for babies during this period, I wanted to ask if there are natural remedies that could help bring down the itching. Okay.
How are you guys on blossom speed today now? All right.
Okay.
Sorry, please.
All right, let's
just
go.
take this one. Hello, good morning.
Good morning.
Please turn down the volume of your radio, sir. Turn it down completely so we can hear you. It's still very high. Turn it down.
Hello?
Yes, it's better now. Thank you. What's your name, sir? Where are you calling from?
It's Monday. I'm calling from Guarimpa.
Okay, Mr. Monday from Guarimpa. Go ahead. Ask your question.
I want to ask, for adults who are having a bleeding gum, what would be the cause? And then probably what is the solution?
Okay. All right.
For adults having bleeding gums.
Yeah. Sir, do you have an answer to that?
There are many reasons why an adult can have a bleeding gum.
Okay.
From minor things to something very serious.
Okay. Like minor things like?
Simple using hard brush can irritate the gum and it can bleed. But more serious things can be responsible for that. So I will advise that person to see his dentist, and they will advise him on what to do.
Okay.
All right, doctor. So I was asking for natural remedies, that could ease down the itching during the teething period.
Well,
because most times these babies, they don't sleep at night. They find it difficult to even sleep at night and all that. So I wanted to know if there are other things you could do naturally apart from doctor's prescriptions, all of these drugs that our mothers prescribe and all that. I know my mom was telling me about grip water and all of those things. So I want to know about natural remedies you could use in order to.
The issue is if they have some irritation around the gum, a little dose of paracetamol will help. Then if you can get a clean gauze, damp it, and then the baby can chew on it, that will give a little relief. You can wash your hand, use your finger and rub on the gum. That will help the baby.
Fantastic.
Some use some dummies that are hard, that won't break, so that the baby can bite on it. But please, those ones there are some that can be dangerous. Because sometimes in 2017, American Journal of Pediatrics reported a case of lead poisoning. Because a baby was given bracelets to bite to help relieve the
teeth.
And from that bracelet, that baby got lead poisoning, and it became a very serious problem. So we should be careful what we even give babies to bite. And things that can break can also be dangerous, because if they break, the baby can aspirate. So it can be dangerous.
I know there are also teething objects, that have liquid inside.
Yes, those ones are also dangerous because they can break and then the liquid can go in. Now, if the liquid is not water, it could be a dangerous chemical. People have used things like gels that are anesthetic gels, which are found to be very dangerous. Benzocaine is usually the main component in it, but it's been found to be dangerous in these kids. So they should stay away from this because they are dangerous.
So can you also emphasize in cleanliness of some of these objects, especially around the teething period for a baby?
Yes, because at that time, anything the baby carries is going to the mouth. Anything. If they have a shoe nearby, they will put it in the mouth. So you have to be a little extra careful. The toys should be clean because they will be putting those toys
in their mouth.
And any toy that can be swallowed or that can break, at that time you have to be careful because the baby can put it in the mouth and it can cause aspiration. So we should stay away from such toys.
Okay, a lot has been learned, so we already know that teething medicine, it's not a problem, the doctor said. So why should there be medicine
when there is no disease?
When there's no disease, it's so hard to take in, but I'm sure with time, Now let's talk about the awareness creation when it comes to all of these things, because a lot of mothers still believe. You see, one of our callers said that even before the baby was born, as of, if I remember, 2 months or something, there was already administering of pecan. So how is it possible that we can start to tell mothers what kind of awareness creation are doctors and organizations doing to make them realize that really all of this seemingly, seemingly.
Interestingly, if you look at those drugs, I don't want to call brand names, but since you called one, if you look inside, the component is just paracetamol there and diphenhydramine. Now, if you are buying
diphenhydramine,
it's an antihistamine which actually can have a lot of side effect in the babies. Some of them, it can cause even convulsion. Now, if you look at it, if you are buying a bottle of it each, it will not cost you more than 500 naira. But if you are buying it like that, you are going to spend close to 3,000.
Yes.
But these are drugs that are not even required.
So the emphasis now would be, sir, please just repeat and repeat again.
The emphasis is that teething is a normal process.
Right.
And teething produce only teeth. If you see any child having diarrhea, vomiting, fever, cough around the teething process, teething period, please, those are entities different from the teething, and they should be addressed as such.
Okay, doctor, having talked about everything that regards to you've talked about almost everything that has to do with the baby's teething, but I want you to emphasize again on the first signs, the earliest signs that you know when a baby is teething, those first signs that you spot out to know that, okay, this baby is beginning to teeth and all that.
Okay, they are likely going to be like drooling saliva, and they will want to be chewing and smacking on the gum, and anything they catch, they will want to put it in the mouth. Some of them may be a little pussy because of the little irritation and itching they are having there. But fever is not a...
So if a baby runs temperature,
please, there is a reason for the temperature.
Yeah?
It should be looked into.
Okay, so if you are still interested in asking questions on the show today, I know 1,000,001 questions that people have asked me. I'm going to ask one right now. Now, is there any need, sir, to brush a baby's teeth? Some mothers feel like from the period when they're born, first 6 to 8 months, there's really no need, that all you need to do is just just clean with warm water, or even when the teeth has come out. I know some babies will start to spot their first tooth from 4 or 5 months, but I've met mothers that say, no, it's not necessary. Why would you be stressing the baby's mouth? This is a fresh baby. There's no need to be cleaning. What are you cleaning? And then some other mothers have you would clarify that the fluoride, the toothpaste that we use, it's not good for babies, so that's why they do not clean their baby's mouth or teeth. Please throw more light on that.
Before the eruption,
right?
If you have to clean the baby, you can use just a warm gauze,
right,
or a clean handkerchief, something like that.
Right.
And clean gently on the gum.
Okay.
Now, when you have the baby has about 2 teeth or so,
right,
you can also use the same method in cleaning,
right.
But if you are going to use brush, you have to stay away from those tooth paste that contains fluoride, because at that age, truly, babies can't spit out or swallow,
right,
and it's dangerous.
Right.
So I wouldn't attach particular age when you use it,
okay,
but at the age when the baby can spit out,
okay,
when the baby will understand that, okay, I'm not supposed to swallow this.
Right.
Usually when they are above 2. Otherwise, you can use the gentle, simple, soft brush.
Right.
Earlier than that,
right,
clean with water.
Right.
And that will be it. You don't need toothpaste that contains the fluoride.
Okay.
Because the fluoride can be dangerous, honestly.
Okay. Right. So that is my question.
All right, doctor, just before we wrap up, okay, I want you to say a word or two, because I met a couple of people yesterday, not just yesterday, I was at an event yesterday, babies sort of thing and all that. So I met a couple of mothers who are going through this period, through this process and all that. So what final words do you have to tell a mother who is currently going through the process of her baby teething and all of that? And, what last words do you have to tell them before we wrap up? Okay.
Know that teething is a normal process. If you see anything abnormal, it's not likely from the teething. For mothers whose children have some delay
in teething,
it may be an advantage.
Right.
For example, those that have small face, if the teeth erupt early enough, they may have overcrowding.
Right.
So God in his infinite mercy may decide to delay that.
Right.
As they grow older, the jaw becomes a little bigger, and then these teeth come out, and that reduces the risk of overcrowding. So that's so for some of them that have delay, it's not really bad.
All right.
That could be the reason.
Okay, let's take this call. Hello, good morning.
Hello, good morning.
Good morning to you, sir. What's your name or where are you calling from?
My name is Kingsley. I'm calling.
Sorry, you didn't get that.
My name is Kingsley. I'm calling you from Central area.
All right, Mr. Kingsley, thank you so much for joining the show today. You have a question? Please ask.
Yes, I have a question.
All right, go ahead.
Yes, please, I want to ask you. Sometimes a little baby, what you might just take out.
Kingsley, sorry, you might want to speak up. We can barely hear you.
Yeah, I say a baby below 2 years. Sometimes the body might just be a little bit cold.
Okay.
And the baby is okay, he's eating fine, he's doing every other thing normal. What could be the cause? And that situation, are we supposed to give any medicine for that, or we should just leave the baby like that? Come back. I want to know that question.
This baby in question, is the baby teething?
No. The baby is not. Yes, it's below 2 years. But the baby is out. It's not purging, it's not vomiting, but I don't know what could be the cause. Sometimes the body might just be a little bit hot, and it stops. Sometimes I give paracetamol. So what could be the cause? Is it as a result of this? So I just need to know.
Okay, doctor. So this baby eating fine, doing fine, but once in a while we run temperature, they would administer paracetamol and it would reduce and go back to normal.
Okay, let me say that.
Alarm?
Yeah, let me say that our body temperature fluctuates between about 36 degrees to 37.5. Now, if you are using your hand to assess the body temperature, it may be a subjective thing.
Right.
But if you feel the baby is having temperature, please use a thermometer to measure the temperature.
Right.
And if you establish that there is fever, then that child needs to be evaluated.
Okay.
Because the fever definitely is not normal.
Right.
There are situations when you can have a fever that will be on and off, but the child is still strong. But that could be a warning sign.
Yes, I totally agree.
You need to do something.
I totally agree.
So if you establish the fact that there is a fever, then the child needs to be evaluated.
So I wanted to also ask, well, how long would that fever need to run for you to start to, get worried? Because I know some fevers would last for like a few minutes, and stop. And then some others will keep, fluctuating for a while. It could go on for like a day.
Yes, the idea is first of all establish the body temperature.
Yes.
Because sometimes you may think that the body is hot, but when you check the temperature, you'll see that it falls within the acceptable range, like 37.5.
Right. So anything above 37.5?
Yes.
For how long?
No, anytime you establish there is a fever,
right,
then it needs to be evaluated.
Okay.
Let me give you an example. A child that has cold.
Okay.
May have a low-grade temperature of 37.8, 37. He may not require more than just the paracetamol and he's active and all that. But at least you have been able to establish that, okay, the reason for this temperature is coming from this.
Right.
So that you don't assume until it gets to 40 degrees.
Right.
I like the fact you said you don't assume.
Yes, most of the time, so I will say we're very negligible, we're tired, we're like, it's just temperature, just give him paracetamol.
Yes.
And you give paracetamol and your temperature is not going down. And you're using your thermometer, it's not going down. So parents, mommies, caregivers, daddies, most of the calls we had today were the daddies. Yeah. So big ups to every daddy that called today.
It's great.
Doing
Happy
great.
that daddies are more active.
Yes.
And I'm more concerned too.
Yeah.
I know. So thank you everyone who called into the show today. We're so grateful that you were able to be a part of this one. And just in case you listen to the show, you're not a daddy or a mommy, I'm sure you have a daddy or a mommy who's a neighbor.
Definitely.
You can pass on the information that we, had today. And then if you want to make more inquiries, Nizamiye Hospital is available. Yes, for all of your inquiries, the doctors are up and doing, and they'll be able to, give you all the necessary advice you need for your babies and your children. Now for children, sir, because this is about teething in children, and I understand that there's still a process where even after you formed your milk teeth, you start to deal with the milk teeth falling and then growing the permanent teeth. Can you give us just a little advice on how to care for that period too? Because some parents get into a dilemma and then it affects some of the older children once the milk teeth starts to go off and then the permanent ones start to come on. How do they deal with that period?
Usually by the age of 6, that is when they begin to shed this milk teeth.
Yeah, can it happen earlier?
And yeah, it can happen. But we're looking at the majority of the children, maybe about 97% of them, are likely going to fall within that age group.
Right.
And that is when, between the age of 6, 7, that is when they are likely also going to have the first permanent teeth.
Right.
Around that age, they are smart enough to use the toothpaste we are talking about, because they know that they don't have to swallow it.
Right.
And they should also know that it is very important at night, after the last meal, they should brush their teeth.
But it's so hard to get them to do that. Oh, Lord.
Yes, but They listen. Auntie can help because they listen to Auntie. Auntie can help and tell them.
And the older ones could help.
If Auntie tells them, I'm sure she will. They will.
Okay.
They will.
All right.
Before going to bed, they should brush their teeth. And especially after taking very sweet things, they should use, even if it is just water, to flush. To flush the teeth, because those sweet things staying on the teeth will draw the attention of bacteria that is food here, and from there they can damage the teeth.
Right. Okay, so I met a very young boy who says, Auntie, I don't have to, I use my floss, so why do I have to brush? I just floss. They're getting used to using the flosser. Just do choo-choo-choo-choo-choo, and that'll be it. Please, he's listening. Do you think it's just the flossing? Is that enough?
No, it's not enough. There is need to use the toothbrush
and paste.
And paste. And thereafter, you can use the floss.
Okay, so you heard it. I know you're listening to me. You're in the car, you're listening. So it's not just about flossing. Auntie, I floss. No, you need to brush your teeth and you need to use your toothpaste. You need to gargle, do all of the things that will make your mouth feel good.
All right, thank you so much, Doctor, for coming around. It's been a fantastic time having you on the show. And I've learned a lot with regards to children, teething, and, all of those processes, the natural remedies and all that. But yes, thank you again to Nizamiye Hospital for powering this beautiful, beautiful Healthy Tuesday show. And again to everyone who called into the show. And yes, this program comes your way again every Tuesday. Next week, Tuesday, is Christmas. So yes, we're having a break from Healthy Tuesday next week. But, it continues the upper week and it goes on and on. Okay, our normal programming continues from now until the hours of 5 o'clock. Awesome Man is going to be here with you guys, giving you all of those beautiful, playing all the...
You didn't have to rub it in, please.
Playing all the songs, okay, and keeping you more entertained here at 94.7 Silver Best Rhythm FM Abuja. Stay tuned, of course, again, yep, of course.
The sweetest voice on the mic. The most awesome voice on radio. Awesome ever. She's awesome. She's awesome and she's the baddest bee in here. Awesome and on 94.7 Abuja.
Yep, you know this.
Returned yet. I'll have him call as soon as he comes in.
As soon as it's dark. Scream that you hate me when I know you don't. It's okay. Up so much, I'm still surprised you don't. What's your plan? To love me forever like you promised in 11th grade and never break that promise, even though I did.